Hello! Welcome to today's lesson on the use of tracers. Today we will learn what tracers are, how they contain radioactive isotopes that emit radiation, and how this allows them to be easily detected and tracked. Then we will explore how tracers are used in medicine, and then examine the specific case of technetium-99 as medical tracer. So far, you are familiar with radiation damage, contamination, and their effects on living tissues and the environment. Building on this foundation, we can now introduce the concept of tracers and understand how their detection and tracking advance our knowledge in fields like medicine. Let's get started. Tracers are substances that contain radioactive isotopes which emit radiation. This emitted radiation can be easily detected and tracked, making tracers highly useful in various scientific and medical applications. It's akin to putting a ball with a GPS chip into a river and then tracking its path to gather information about the river's flow. In medicine, tracers are used to help doctors diagnose and monitor disease processes in the body. These radioactive isotopes can be inhaled, ingested, or injected into the bloodstream. Once inside the body, doctors can track how these isotopes are absorbed and distributed by using special imaging equipment, like gamma cameras. This allows them to assess the functioning of different tissues and organs. For example, by tracking a tracer's movement through the bloodstream, doctors can evaluate how well the heart is pumping blood. One of the most commonly used tracers in medical diagnostics is technetium-99, TC99. TC99 is favored for several reasons. One of these is because technetium-99 emits gamma rays, which can be detected outside the body using gamma cameras. Gamma rays are highly penetrating and can pass through the body, thereby creating detailed images of internal structures. Additionally, gamma rays, being less ionizing, are less harmful when inside the body compared to other types of radiation such as alpha particles. C99 has a relatively short half-life of about 6 hours. Remember that the half-life of a radioactive isotope is the time it takes for half of the isotope to decay. A short half-life like this is particularly advantageous in medical applications because it means that while the tracer is active during the time of scanning, it decays quickly afterwards, minimizing the radiation exposure to the patient. This makes the procedure safer, ensuring that the patient is not subjected to prolonged radiation. A final benefit of technetium-99 is its high activity. During the scan, the high activity of TC99 allows doctors to gather valuable diagnostic information. The short half-life means high levels of radioactivity can be detected in a concise time frame, which provides clear and accurate images of the area of interest, facilitating effective diagnosis and treatment planning. Gamma cameras are specialized devices that detect the gamma rays emitted by the tracers like technetium-99 inside the body. These cameras then convert the gamma radiation into images that display how the tracer is distributed in the body. By analyzing these images, doctors can ascertain the functionality of various organs and detect abnormalities. The use of technetium-99 as a tracer exemplifies how the properties of a radioactive isotope can be leveraged to enhance medical diagnostics. Its emission of gamma rays and short half-life ensure that patients receive accurate diagnoses with minimal exposure to harmful radiation. These properties collectively make TC99 an ideal tracer for medical purposes. In today's lesson, we examine the use of tracers and their significance in medical applications. We first discussed how tracers are small amounts of radioactive substances used to diagnose and track the progression of medical conditions. These tracers emit radiation that can be detected by specialized equipment, providing vital information about the function of specific organs or systems within the body. We highlighted the importance of selecting an appropriate isotope based on its half-life and type of radiation emitted. A suitable example we explored was technetium-99m, widely used because of its ideal half-life and gamma radiation emission, which ensures effective imaging while minimizing patient exposure to radiation. In summary, understanding the use of tracers in medicine allows us to appreciate their role in non-invasive diagnostic techniques and the broader applications of nuclear radiation in healthcare settings.